People's Pharmacy for all your pharmaceutical, skin, and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes. A pleasant good evening to you. Kamal, you hear me loud and clear?
Yes, I am. The floor is all yours.
Well, I'm sure that persons could tell from the background that I am not actually in studio. I am actually 5 hours ahead of you. It's now almost 1 o'clock in the morning. I am in Austria, Vienna, Austria. I don't think this is some exotic type of thing. Yes, I am at a hotel on the Blue Danube. You heard of the song, the Blue Danube, and so forth? Well, I'm at a hotel here attending a conference at the United Nations, where today I basically held a special session where I was representing the Caribbean and talking about what's happening in the Caribbean with respect to medicinal cannabis and so on. But this evening, I'm not going to talk about that. During the conference, I was able to attend a number of other sessions. And one of the sessions has really alerted me and has coined the topic that I need to speak on today. And it is called hepatitis. Now, you may wonder, what the hell is hepatitis? Ever heard of that before? Some of you may have heard about, know all about it. But I want you to understand that in your body are different organs. You know about your heart. You know about your brain. You know about your lungs, right? And you would know about your kidneys. But there's another important organ of the body called the liver. The liver. Some of us, we love to eat liver, from duck or chickens or what. Yeah, I understand that's tasty. But our liver lies to the right side of your body, just underneath your ribs. It's inside your belly, but it's just underneath your ribs. And your liver is really, I would say, about a little smaller than the size of my head. Yeah, the liver is quite a large organ. Yes, Sam? And it has a funny shape, but it tucks in under the rib cage over on the right-hand side. And your liver is very important. When you eat food, the food goes into your stomach, goes into your intestines, where all the good stuff is absorbed. But before those nutrients get fully into your body, it has to pass through the liver. It has to pass through the liver first. And so there is some blood vessels that take the nutrients as it gets into your body and your bloodstream, into a special kind of bloodstream, and pass it through your liver first. Now, your normal blood, that's also passing through the liver. So your liver is a kind of a cleaning agent, a filtration agent. It has these special cells that can take up a lot of the toxic stuff that we eat, that's in our body and so forth. And the liver is an absolutely great organ. Without the liver, you are gonna die. You crapple smoke your pipe. You basically will just shrivel up because of we're constantly eating and ingesting chemicals and other things like that, and you need the liver to neutralize those toxic chemicals And hopefully, if those toxic chemicals are in just small amounts, then you're okay. But if you are guzzling down a ton of stuff, toxic stuff, then you could be in trouble. But sometimes the liver can run into problems. Matter of fact, it could become inflamed. And this is what hepatitis is really all about. Hepatitis is an inflammation of the liver. An inflammation of the liver. And I want you to understand that some people, their liver could become quickly inflamed, acutely inflamed, it just flare up, inflamed. Or some people, their liver could become inflamed over a chronic or long period of time, right? Now, whenever the liver is inflamed, we call it hepatitis. And it could be acute hepatitis, it could be chronic hepatitis. Acute means sudden, chronic means going on for a long time. But each of these is not good, you know? So you can be exposed to many things that can cause a hepatitis. I won't go through a few of them, but I'm going to come down and tell you what I'm going to focus on today, right? But, you know, in terms of, you know, hepatitis, we sometimes develop hepatitis because we have been exposed to certain chemicals, right? Toxic chemicals. Let me give you one important one: rum, alcohol. If you basically have been consuming too much alcohol, your liver has special mechanisms to neutralize most of the alcohol. But if you're just overdoing it, your liver can't keep up, and your liver starts getting damaged by the same alcohol that's in excess, and you develop alcoholic hepatitis. There are a number of other chemicals, you know, if people are around cleaning substances, chlorine, those things could be inhaled, and sometimes they could inflame the liver, and a host of toxic chemicals, if they get into the body, that can cause that. Then there is something called autoimmune hepatitis. This is where your body starts to look at the liver in a funny way. You know how you walk down the road, sometimes somebody watch you as if they don't know you? You know, somebody watch you, they know you, they don't even say good morning. They used to say good morning, they stop saying good morning to you. Matter of fact, they want to attack you. Well, I want you to look at it in this way. If your body stops recognizing your liver as friendly, and your immune system starts to attack your liver, therefore you have what's called an autoimmune hepatitis. That might sound strange. You wonder how the hell is your body going to just turn on top of your liver just so? Well, there are many conditions like lupus, certain type of arthritis, many different conditions in which your body just gets nasty, starts to attack different organs, and the liver is one of those. You know, there are certain types of bushes, bush tea and so forth. There's some great bush tea, but there's certain things that you shouldn't really be drinking because they could also affect the liver. And then there's what we call viruses, viral hepatitis. This is what I'm getting to today, viral hepatitis. Matter of fact, there are a number of viruses that can affect the liver. Some, the liver may not be the primary thing that it attacks. You know, it might attack the kidney or something else, but then it also attacks the liver. Well, there are a series of, what's going on? There are a series of viruses, what we call hepatitis A, hepatitis B, hepatitis C. And then there's some others, hepatitis D and hepatitis E. Many of you haven't heard about, but each of these can affect the liver in their own way. Some are similar to each other, and that's what we're going to talk to you about today. But when you have hepatitis, what are the symptoms? Hepatitis can be sneaky. You may not even notice the changes in your body right away. And when you do, you may notice you have some diarrhea, or that you're fatigued, or you're feeling weak. You may have a fever. You may feel nauseous if you feel like you want to vomit. You may have loss of appetite. You may want to eat. You may even have pain where I told you the liver lies. There may be an ache across it. It may not be a sharp pain. It may be an ache, a belly ache, as we call it. Now, as hepatitis gets bad, you could get getting confusion. And guess what? When your liver becomes inflamed, there is the release of a lot of bile into your blood, into your bladder. So your urine starts looking dark. That's because of certain chemicals that the liver deals with are being leaked into your urine. You also start getting itchy skin. Matter of fact, your skin may start getting yellow. Your eyes may become yellow, what we call jaundice. Jaundice. Somebody's eyes become yellow and jaundice. If you're light skinned, we will also notice in your skin too, you become yellowish, right? And these are some of the signs. So the most common cause of hepatitis are actually the viruses. And let me give you a kind of idea. You have to understand hepatitis A is a virus that causes inflammation of the liver. Really, it does. Hepatitis B is another one that causes inflammation. Hepatitis C is the big one now, and that is one that I want to talk to you a lot more about. Then there's hepatitis D and hepatitis E, and we talk about those as well. But I want you to get an idea that the hepatitis is usually in your body fluids when it infects you. And it could be, this virus could still survive in your saliva, in your semen, in your vaginal fluid, in your blood, and therefore you can find yourself infecting someone else as they are exposed to certain body fluids. Now, let me start off with hepatitis A. So hepatitis A is mainly a virus that is spread by contaminated food. Contaminated food. Someone who has hepatitis, well, guess what? The virus is being shed from the intestine into the stool, into the feces. So if the person goes to the bathroom, and suppose they work at a restaurant or they work in a market, and they have to run to the bathroom, but there's no bathroom, there's no toilet paper, or they say there's no water to wash their hands. Well, after trying to clean themselves, they may still have some remnants of the stool on their hands. The hands may still be dirty, and the virus may still be there. So they come by and you ask for an apple, or you ask for some grapes, or you ask for some other fruits that are not covered, like a banana may be covered in a skin, you peel it back. But fruits that you put into your mouth, you won't get a chance to wash either. When you eat, you're eating the virus that is on top of that fruit. If a person has prepared a salad and the salad, is there. If for that matter, if the person has contaminated some water, somebody dips up some of that water, and they use that without the water being boiled or whatever, they drink the water or they use the water to prepare a salad, which won't be heated. And so you are ingesting that hepatitis A. And when the hepatitis A gets into your gut, down your throat, in your gut, that it makes that hepatitis A virus happy. It starts to multiply. It causes problems, causes a host of the diarrhea, causes inflammation in the liver. You go yellow and you're sick. Luckily, hepatitis A doesn't really kill so much. You know what I mean? Hepatitis A causes a big infection, and your body usually clears it up by 6 months. After 6 months, most people are over their hepatitis A. And guess what? There's a vaccine that you could take to prevent you from getting hepatitis A. I made sure I got mine a long time ago. Protects me, so that if I move around different places, go to a market, and there's hepatitis A on the fruit, and I can't wash the fruit, I can't wash the strawberries, I can't wash the raspberries, I can't wash the cherries or whatever this might be, then guess what? I am still protected. But if you don't have that, haven't had a vaccine, and so hepatitis A could come and affect you. Now, there is another type of hepatitis called hepatitis B. This was before the big one. Now, there are over, let's say, 200 something million people with hepatitis B. It's common. But hepatitis B is mainly sexually transmitted, believe it or not. It can be spread by blood transfusion. It can be spread, even a woman who has hepatitis B who's pregnant. As the child is being born, children can pick up the hepatitis just from coming out through the female vagina during pregnancy, because the vaginal fluids would having the hepatitis. And, hepatitis B is a kind of a silent disease. But over a period of time, hepatitis B causes chronic inflammation of the liver. And when the liver becomes chronically inflamed after a number of years, the liver starts to shrivel up. We call it cirrhosis of the liver, fibrous cirrhosis of the liver. And eventually, these people with cirrhosis could also develop liver cancer. Livers that are shriveled up, that are scarred up from chronic hepatitis inflammation, are prone to developing liver cancer. And so, the hepatitis B spreads by contaminated blood and body fluids. And once again, sexual contact, childbirth. Matter of fact, household contacts. If you have hepatitis B and you've been shaving with a razor blade and you put it down, and someone comes and uses that same razor blade without washing it thoroughly, they could pick up the hepatitis B from your razor blade, And the hepatitis B can live outside of the body for up to 7 days, remaining infectious and highly contagious for 7 days on different type of things. So we say that there's a treatment for hepatitis B. We can give you certain drugs that will suppress the virus and make sure that the virus isn't rearing its ugly head, but there's no cure for hepatitis B. No cure for hepatitis. We can suppress it to make sure it is not causing chronic inflammation, but there's no cure. So I want to encourage people, you could get tested for the hepatitis B, and we can check to see if you have a chronic ongoing inflammation. And the bottom line, is the medicines that we would need to give you if you have it would suppress the virus to prevent liver damage, to prevent scarring and shriveling up of the liver, what we call liver cirrhosis or liver cancer. And you want to know the amount of people who have hepatitis B. Now, everybody up to the age of 60 should be vaccinated for hepatitis B. Now, there's another virus called hepatitis C, HCV, hepatitis C. Now, this is the most common type of hepatitis, believe it or not. And it affects a lot of people around the world. You know, a lot of people around the world are affected by hepatitis C. And, you know, a number of people have had blood tests to know they have hepatitis C and therefore can undergo some treatment. But guess what? Half of us, half of you, I know I don't have it, but half of you don't know if you have it or not. And when you don't know, hepatitis C often goes on to be chronic hepatitis. And this is another hepatitis, viral hepatitis that causes liver cancer. Matter of fact, hepatitis C is the most common cause of liver cancer. The big difference between hepatitis B and hepatitis C. Remember hepatitis B? We can give you medications to suppress the virus. But guess what? Hepatitis C, we have a cure. There's some special medication that we can give to kill off the hepatitis C and cure you. And many places now boast of 99% cure rate of hepatitis C. But guess what? If you haven't been tested, if you don't know you have hepatitis C, if you don't have any idea that the hepatitis C is causing chronic inflammation of your liver, is damaging your liver, leading to liver cancer, you're not going to find out until it is too late. And that is what a lot of other people find in due course, especially men. Men don't go to doctor, blood tests, getting stuck for a blood test. Nah, no way. You know, and on top of that, if a person is drinking alcohol, lots of alcohol, on top of the hepatitis, you could see it's like a double whammy, hepatitis C plus alcohol. Oh my God. You know, now there is no vaccine for hepatitis C. There's a vaccine for hepatitis B to prevent it, but none for hepatitis C. But there's a cure for hepatitis C. So hepatitis C continues to spread. I was looking at some work done today in Egypt, where they had close to about a certain number of people with hepatitis C. But guess what? They were able to show that each year they cure 5% of the people with hepatitis C. But guess what? There's 6% new infections. So because a lot of people don't know they have hepatitis C, they are through all kind of different means. And mainly it is due to people who take intravenous drugs. Hepatitis C can be spread sexually, but that's not the main way. Hepatitis B is spread sexually. Hepatitis C is not so much spread sexually. It's spread by people who are using heroin and other injectable drugs. But it also occurs in people who are on dialysis treatment, or people receiving blood transfusion or an organ transplant. But by hepatitis screening, we've been able to cut a lot of those things out, like from a blood transfusion. And so don't be scared about receiving blood. You're not going to get hepatitis C from that because it's really thoroughly screened. But too many people don't know they have hepatitis C. And as a result, it is a problem. I said sexual transmission hepatitis C is not that common, but can occur. And there are what we call hepatitis D and hepatitis E. Hepatitis E is another virus that actually is quite common, that causes diarrhea and comes really from the food you eat that's contaminated. And hepatitis D is a little similar to hepatitis B. Now, both women and men, viral hepatitis typically can cause nausea, vomiting, belly pains, I said. It can cause yellowing of the skin, which is called jaundice, yellowing of the eyes, the white of the eyes get yellow. And you can have fevers, the urine goes dark, and you get itchy skin. It's almost like you're having a rash, right? But sometimes the virus, these hepatitis could affect the kidneys as well. The important thing is if you experience any of these kind of symptoms, and you don't know what the cause is, you should talk to your doctor. Don't ignore it, because they will just be able to do a simple blood test and be able to find out if you have one of these hepatitis. A stitch in time can save 9. Liver cancer, cirrhosis of the liver, is one of the worst type of cancers you can have, and you basically want to make sure you don't have hepatitis B and hepatitis C. There's a cure for hepatitis C right now. Medications are available to do that, but there is not a cure for hepatitis B, but treatment for hepatitis B to suppress the hepatitis B. We're going to take a little break now, come back. We can get a little more into this and open up the lines for some questions and so on.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456-1170. People's Pharmacy also stock vitamins and supplements, personal care items, toiletries, children and adult pampers, and much, much more. And of course, get your prescriptions filled by a friendly and professional pharmacist. People's Pharmacy. Come in today and let us serve you.
Yes, so we're back. Now, I want to say a special word about hepatitis E, and hepatitis E. But
Dr. Thompson, before you go, I don't know if you can see the comment section.
Oh, there's some questions, are there?
There's a question there.
Sure, please let me know. Let me get it.
I don't know if you can see the comment section. You're supposed to. You should see what I'm saying as well.
Let me see. I had my screen down, the comment section, and no, I'm not seeing your comment section.
On your right hand side, it should be on your right hand side.
Okay, I actually have my notes up, and I minimized the screen.
Okay, but anyways, I can just read it out for you.
Read that for me, please.
The person writes, good night, Dr. Thompson. Can the organs of a deceased lupus person be used for transplants to other persons?
Okay. Good night. Yes. Good night. Good night, okay. Dr. Thompson. Can the organs of a deceased lupus person be used for body transplants to other persons? Now, if a person is looking to donate parts of their body, because their liver or their heart or whatever the case might be, to a donation service, and would like their body part of their body to be used for someone else benefit, that this is usually something that is done well in advance. There has to be a consent for it and so forth. If the person is not, if it happens very suddenly, then if there's no consent, sometimes the family members can give consent. But normally, in many countries, they ask people in advance, well, if you have the murder happen to you, would you want your organ donated? Say, yeah, I don't mind that. And so that's on record, Now, the time for transplantation has to be almost immediate, because when somebody dies, those organs of their body starts to deteriorate and die too. And there's a narrow period of time in which the organs can be used. Liver transplant is an important form of transplantation. And yes, it depends on if the liver has been affected or has been previously damaged or is a cause of an illness. So if somebody has hepatitis of the liver, you're not going to want that person's liver to be transplanted. You want a clean, usable, lasting liver to be available from somebody. So lupus is another inflammatory disease that can affect many different parts of the body. Matter of fact, there are many forms of lupus. There are a couple of big forms of lupus. There's what we call lupus that predominantly affects the skin. It's called a discoid lupus. And there's what's it called? Systemic lupus, SLE. I know I'm getting into some technical stuff, but you have to be careful that the lupus, the systemic lupus, is not really that bad. It's already affecting the liver. So the answer to your question, long and short, is that yes, it can be used if immediately used after the person's death, right? And that the doctors know about it and there is a candidate ready to receive it, at the same time. It's difficult to store these things up and wait. You store them up like you put in some meat. I gotta say, there's some meat in a fridge or freezer, seasoned and so forth. It ain't like that, Now I could see the caller is, yes, it was given well in advance in the US. Also, the notice was given well in advance in the USA. So yes, the liver definitely can be used, but they would want to make an evaluation to see if the lupus in any way was now affecting the liver. So if the liver was absolutely clean, if the liver was perfect, if the liver did not have a chance of also being affected by the lupus in itself, then they would have been able to use it. And I'm pretty sure there would have been persons who might have required a liver transplant. I mean, hepatitis is one of the big reasons for a liver transplant. Hepatitis.
We have a caller, Doc.
Yeah, sure. Thank you. Go right ahead.
Good evening.
Yes.
Yeah, good evening, Dr. Thompson.
Good evening, Mr. Roberts. Yes.
Well, yeah. Well, this is your friend, I would imagine, or I would still hope, even though you have some mischievous people trying to put a wedge between the two of us. For whatever reason.
I'm a family friend, Audrey, Teddy, and our most recent deceased Kenny, and you and your dad.
Yes. I hope they're listening to you, because we have some real troubleshooters in this place. Anyhow,
all right, okay, all right.
I always enjoy your medical information.
Sure.
I'm a doctor, so I love to hear what the doctor has to say.
Yes.
Especially on these radio programs. And as you know, I am not the wholesome person that I used to be at one time. And I'm always interested. And sometimes I wonder how come people don't bombard your program with a lot of questions. Yeah, so talking about hepatitis, I heard about hepatitis for some years now. I mean, maybe because I never pay much attention. I don't know. But what I want to, the long and short of it, what I want to question you, is this something that is creating a major concern in our country right now? Is it
Let
something?
me
Yeah.
yeah,
Uh,
let me say there's some good things that have been happening. First of all, hepatitis A and hepatitis E are foodborne, and places that don't have good water, have contaminated
okay.
water, they have high
All
outbreaks
right.
of hepatitis A and hepatitis E. We're lucky. Our water system is great. We have pipe-borne water that's excellent, come from the hills, and that's one good thing. The second thing is hepatitis B. In St. Vincent, we have a pretty good vaccination rate. I'm always worried that a whole ton of people are going to start stopping. Man, since COVID, I ain't getting no vaccine anymore. None, none at all. But we've had good vaccination rates, and I think that it has been able to prevent more outbreaks of hepatitis B, which are sexually transmitted. And so, hepatitis C, I think that silently, we do have hepatitis C here. It's not sexually transmitted, but luckily, it is mainly transmitted by like heroin addicts, people who do IV drug abuse, and through dialysis centers.
Mhm.
Well, I know our dialysis center is great. They do screening and they do things properly, so there's no problem. And luckily, we don't have
So,
a lot of people on heroin, intravenous heroin, IV drug abusers and so forth. And so it's a good thing that hepatitis, but hepatitis B, I still think is quickly.
all right. Let me just come back in here. You see, all of a sudden, I've been hearing it's to me as there's a resurrection, my word, of a lot of these uh, diseases that I would have heard about a long time ago. As though there is a resurrection or a new rise or increase or whatever, however you want to put it, with these because there are some diseases that we were told um, were or no longer exist, and sometimes I wonder if you get a. I wonder if that is true. If it is true to say that you can get rid of any disease that you would have suffered, as a victim from. Can we say, for instance, okay, like polio? Polio has been around for a long time.
Yeah.
And even some time ago, I was here. I was shocked when I heard that polio had reappeared or something. So the question is, when we suffer from certain diseases in the early period of our life and so on, I am wondering, and they tell you, well, that's it, or the doctor, whoever you advise you, may say that, okay, we got rid of it and so on. Is it really dead, or could it be in your system, your body, to reappear how much years later on in life? That's one the question. And then I would also like to know um, if there has been, apart from that one that is a big cause, such a big I'm talking about COVID and so on. Are there new diseases, or is there a fear of any new diseases making their presence felt in this country? Hey, they were talking about something on the news tonight. What? Oh gosh, I forget the name. Nor something. You might. I don't know if you pick it up. Something on the news.
Nova virus. Yeah.
All right, norovirus. Yeah. So basically, I am just asking these questions. I mean, I how long to live? I mean, I don't need to ask these questions, but of course, while I'm alive, I still have to be a part of what is going on and avoid, if I have to take precautionary measures to keep myself free and healthy in any particular way. So thanks for the information. I'll listen to how you respond to those questions I asked you. Thank you.
Yes. Dave, thank you very much for those questions.
Mhm.
And let me see. When at the height of my infectious disease practice in New York and training, hepatitis B was the big thing. We had not as yet discovered hepatitis C, hepatitis D, and hepatitis E. In other words, hepatitis C has only been discovered over the last 25, 30 years, since the 90s. And hepatitis D and hepatitis E, less than that. We have seen some new viruses emerge. Let me tell you about chikungunya and Zika. The Zika emerged from the Zika forest of Uganda. They went and chopped down a whole forest, and animals that were inside there came out, wild animals, and mixed in with other animals on the plains, mixed in with humans, and we started seeing a transmission of viruses to more humans that were never really exposed to them or only exposed to certain people in that area. Now today, we're able to travel faster. I'm in Austria, so I could jump on a plane in St. Vincent. Someone could jump on a plane in Africa and reach to Vienna, and basically, in a matter of 24 hours, they can bring an illness with them. And if the illness have what they call an incubation period of a week or 2 weeks, they wouldn't start getting sick until they've been here for a week. And if
hope you don't bring back anything.
Yeah?
I just say I hope you didn't bring back anything first, eh?
Well, you're right about that. But you see, one of the big things is I am a believer in vaccines. And so hepatitis B, St. Vincent has a 99.9 record of vaccination. So polio, as you mentioned, yes, it could make a comeback. If people say, you know what, because of this COVID thing, I'm here, Dave, or we hear this other people say don't take no vaccine because vaccine is evil, and 5, 10, 15% of the people come down and say, I ain't giving my kids these vaccines. It then causes a big outbreak. We see measles. We can get vaccine for measles in North America. There are huge communities that have said, you know what, I ain't taking no more measles vaccine. And as a result, measles have now made a big comeback and a bounce back. All diseases have been able to come back largely because of a lack of vaccination that has been preventing them. And polio, as well as measles, belong into that category. But there's also the fact we're discovering, with new technology, we're discovering new illnesses that we had not ever seen or we couldn't explain before. So somebody would die, and it seemed like hepatitis B. But we did not have the technology to really realize it was really hepatitis C, not hepatitis B, or that it was hepatitis D. And now, as time goes on and technology, we are able to pick up these new diseases that may have been around for a long time, but we did not have the technology previously to detect them. And we just ticked a box and said, hepatitis of unknown origin. Yes, Sam? But now we're able to determine and say, well, it's because of this, because of that. So in answer to all your questions, old diseases have been making a comeback predominantly because of reduced vaccination in some countries. New diseases are being discovered as the environment changes, and new diseases are spreading because of international travel and mixing of peoples and so forth, tourism, as well as as migration and so. And lastly, I would say that the technology we have today, the science, we've been able to find up a lot more. Science is really advancing, and it requires a lot of continued reading. And David, I'm going to continue doing much more reading and research. And today I was very inspired by knowing that hepatitis C can be cured. I've known that, but it was able to be explained to me, the medications that are available and so forth. And I want to really point that out to individuals, that we now have some good cures for certain conditions. Yes, Kamal, I think Dave is gone, right?
Yes, Dave is gone.
Yes. Now, what I think is those last questions, right, have inspired additional questions, I would say, in the sense that the liver in particular is a very precious organ of the body. And the liver can handle a lot of rough and tumble. The liver can take a licking, can take some kicking, and would still continue to work. Even though I've mentioned viral hepatitis, I want to point out that rum, alcohol, is one of the more deadly things that can affect the liver. The liver could handle alcohol. It could deal with alcohol. What it cannot deal with is excess alcohol. Excess alcohol. I mean, talk about persons who are drinking themselves crazy. Or I should say, people who are just even moderate drinkers. The liver tries to take the alcohol and break it down, break down the ethanol into more simpler substances and allow you to urinate it out. But what often happens is that even though the liver is doing its job, so much alcohol is about, the alcohol starts to damage some of the liver cells themselves, so that they don't function at 100%. They can't handle as much alcohol. And as a result, you start to develop something they call a fatty liver, alcoholic fatty liver. Yeah. As the cells in your liver get damaged, they're replaced by fatty tissue. And that's not good. The liver doesn't like a lot of fat inside the liver. The liver doesn't mind fat in your belly, in your muscles, in your hips, in your bottom. No, that's not in the, but inside the liver itself, fat inside the liver, boy, I tell you, the liver can't handle that. And that's when fat starts getting inside there, and those fat cells start to cause inflammation. Your white blood cells start to come to the liver to mop up the fat and mop up cause a whole mess, a whole inflammation. I mean, I want to tell you what a mess is caused. A whole set of inflammation, white blood cells mixed in with fat and liver tissue and this, that. That ain't how it's supposed to be. That ain't where the Lord made us supposed to function. And so as a result, scar tissue starts to develop. Scar tissue. And that scar tissue causes the liver to start to shrink. And a shrinking liver means that it can't handle all the good things it is supposed to do. It's shriveling up. And that's where cirrhosis of the liver, when it shrivels up, that's when it's at risk of causing cancer, liver cancer. And boy, hepatitis C is the biggest cause of liver cancer, but hepatitis B is another one. And but on top of that, alcohol causing cirrhosis of the liver is another cause of liver cancer. And I just really have to encourage persons that you got to drink a little bit more moderately. And that real hard stuff. I mean, I know strong rum, nice industry and so forth, but boy, a lot of people are literally messing up their liver, and so in a fundamental way. Whichever country you're in, if you're in North America, you're in England, whether you could be exposed to a lot of it, whether it's strong rum or you drink half a case of beer a day, or what. I mean, there's equivalency there, and it's something that we really should be worried about. So I wanted to tell you that there are substances that can damage your liver. There are inflammatory conditions that could damage your liver, definitely. There are viruses, and I've talked about hepatitis A, hepatitis B, hepatitis C. Hepatitis C is the big one these days, but there's also hepatitis D and hepatitis E. And there are actually a whole set of other viruses. I don't want to mention them. A whole set of viruses that can affect other parts of your body, but at the same time, they affect your liver too. So they don't hit your liver first, but they hit your liver second. They don't hit your liver first, but they hit your liver second or probably third. And they get you anyway. They find a way of getting your liver. Remember that if you are also in a situation whereby you live in parts of the world, or you travel to certain parts of the world where the water supply is not that great, don't just drink water from a tap. Don't just go to someone's house and say, can I have a glass of water? You don't know if that water's been taken from a well in the back of the house, and if that well is near to the septic tank water, and there's contamination of the water in the well. There are a lot of people with hepatitis that are going around asymptomatic. They're smiling at you. They're showing us anything is wrong. But some of these people with hepatitis, depending on which type of hepatitis, actually are contaminated. Either their stool, in the case of hepatitis A and hepatitis E, or hepatitis B, they have hepatitis B virus in their blood and their fluids. And for sure, you have sexual contact with them, you catch the virus from sexual contact because their vaginal fluid is infected. Simple as that. Case of hepatitis B, if you somebody, don't use the same razor as someone else. Don't use the same toothbrush as someone else. All these things could cause you some serious problems. Serious problems. And I just want to say that, liver cancer, is the most common form of liver cancer. Is a particular type of cancer, and studies have shown that there's this cirrhosis and scarring of the liver that occurs with hepatitis B, hepatitis C, and with alcohol, can account for about half or all the cases of liver cancer, And if we are able to eliminate hepatitis B, hepatitis C, and cut back significantly on alcohol, we could reduce liver cancer. Cirrhosis of the liver causes liver failure. The liver shrivels up, and this just stops it from working. And it really it's a problem. When the liver gets that bad that it's scarred over, you know what happens? Toxic stuff starts to build up in your blood. And the toxic stuff built up in your blood actually goes to the brain. People with cirrhosis of the liver That's when they start to see little men. They start to have hallucinations. They start to see little men running around the place. They get confused. They don't know what the hell's going on because toxic things that the liver normally controls and gets rid of are building up in the blood because the liver is not working properly. And so you don't really want that at all. We can do tests to detect all these things. Very important for you to make sure you see your doctor regularly. And certainly if you're having fatigue, a fever, for sure, if you notice your eyes start to get a little yellow or your skin, especially if you're light skin and your skin is giving a bronze kind of look and you ain't been out in the sun tanning and you ain't putting no extra cream on your face and so forth, you just go in a little yellow, maybe jaundice, maybe the liver is causing these toxic stuff to build up in your body. And so you need to get lifestyle changes. You need to do other things. And certainly liver transplant can and may be needed in the case, especially of liver failure or hepatitis B. And I'm glad that person asked a question earlier on. We just got to check out to make sure if you have lupus and so it isn't affected the liver. But those who in advance indicate that their organs can be used for transplant, that's a good thing. I've done that, I've said that, and so forth. And anybody who wants my organs, you can have them. Ladies and gentlemen, I think, Kamal, we're at the end of the program, and we got about a minute left, but I think it's a nice time to sign off. Be very careful. And I'm encouraging persons to see the doctor. You could go and get some blood tests, check if you have hepatitis, check your liver out. Find out your liver good. You know, a stitch in time is going to save 9. This is Dr. Gerald Thompson in Austria, home soon. Let me bid you a special good evening and good night.
People's Pharmacy, for all your pharmaceutical, skin and body care needs. Located on Grenville Street in Kingstown. They open 8 a.m. to 8 p.m. Monday to Saturday. Call them today at 784-456